Hello, everyone, and welcome to today's webinar, Accelerating Provider Productivity with Out-of-the-Box Copilot for Healthcare Providers. We're excited to have you here today. I'd like to start off and introduce our speakers, Jimmy Ledbetter and Kevin Leesman. Turn it over to them to get us started.
All right. Well, hey, thank you everybody for coming with us today through this something I'm really excited about. So Kevin and I and Sarah were talking about this a while. It's like, what can we do with everybody, like outside of the box with Copilot? It's some of the intro items here. We're just really excited to be able to spend some time, show you what the off-the-shelf stuff looks like, and then, get a little bit more complex than that. So as far as introductions, I'll introduce myself real quick, and then I'm going to turn it over to my cohort, Kevin. So my name is Jimmy Ledbetter. I'm the VP of AI Strategy and Solutions here at Quisitive. So Quisitive, we are top 0.001% of all of the Microsoft partners. So we actually get to partner very closely with you all, Kevin and Sarah. It's fantastic. I actually been working with Copilot since its inception. So got to see it before it was even a thing. So but yeah, I run a team of strategists here, so we really help people take the idea of AI and really turn it into the physical work. So, Kevin, I'll let you introduce yourself.
Awesome. Thank you, Jimmy. Yes, I am Kevin. I am a Microsoft 365 and Copilot specialist in Florida and Georgia, covering about 30 healthcare provider accounts.
Perfect.
Awesome. So why are we here today? We're here because Microsoft 365 Copilot can bring value to your organization by empowering your employees, reducing manual tasks, and allowing you to focus on the work you love. Work you love, meaningful work, focusing on patient care. With this group, those words are very meaningful. And in fact, it can be life-changing for your patients. This is specifically meaningful to me because there are providers on this call from my area in Florida who my family and I go to. So I take great pride in showing you how Microsoft's Copilot can make your lives easier. Becoming frontier. What is a frontier firm? You may have heard this term thrown around when talking about AI. Frontier firm is Microsoft's vision for an AI-first customer. How does Microsoft look at that? We look at that in four different pillars. One, enriching the employee experience. Let's empower your users to do their best work. Let's create a more dynamic and fulfilling work environment for your employees that allows you to attract the top talent. Second, let's use AI to have a deeper connection with our customers. AI can help us understand our patients' preferences and be more effective in addressing those preferences. A better patient experience translates into higher company growth. Third, and my personal favorite, is getting rid of manual processes for automation. Our best work is done with streamlined operations, increased efficiency, and ultimately higher human ambition for meaningful contributions to your company and therefore to the patient. Finally, as I said, I cover dozens of healthcare providers in Florida and Georgia. I can tell you that there are multiple companies investing in this space, and your competitors are using AI. They're developing a better patient experience with this, and they're accelerating their business because of it. We want to help you do the same, and that's what we'll be talking about today. Next slide. So, we're bought into the idea of AI making our lives easier and the new way of thinking about AI. Now I want to talk a little bit about why Microsoft is the right solution for you. Microsoft's 365 Copilot is uniquely built for AI. Our AI solutions are tailored to your business. Copilot's connected to your business at both the web level and in your own data. What does that mean? That means you receive better output because it is specialized to your work. Furthermore, Microsoft 365 Copilot lives where you already are, in your Office suite. Jimmy's going to be showing us some examples today of how users can use Copilot out of the box in the Office suite. Most important, Microsoft Copilot has built-in security, management, and compliance solutions to keep your organization secure. Microsoft does not save your data. We use it for your business and for the output that's received. Slide. Okay, so we talked about the frontier firm, and Microsoft sees three ways to getting there, kind of a crawl, walk, run progression for our customers. Today, we'll be going in the first phase, the crawl phase, providing every user with a Copilot assistant. This is where users can be empowered and reshape the work that they do. So with that, Jimmy, I'll turn it back to you to show us how that's done.
All right. So let me go ahead and get to my, now I wanted just to go ahead and take a couple seconds, and Kevin, first off, thank you for that heads up. So as we look at how do we help all of our agencies become frontier, I think it's important. You all hear AI agents like crazy. So, like, what are we going to do with this? So what we're going to talk about today is really inside of the HLS space. Like, what can we do and what can we do out of the box, and just get you guys just set up to go first. So before we go into solutioning, which I'm a solution architect in a previous life, so I always like to jump to the end. But first off, what problems are we solving? So we'll send this decked out to everybody, but one of the things that we've noticed, especially in the HLS field, is massive data volumes. Like, there is so much information out there that it's really, really hard for us to sift through it. And something tells me that most people sitting inside of this are living inside of Excel in some form or fashion, or maybe you're crafting emails that are turning into multiple pages and you're like, why aren't people responding? We're finding out maybe they're not reading things as deeply as we want to. So, and to create these documents, it's taking us hours upon hours upon hours. So Kevin brought up a really, really good point a second ago is, we want our clinicians to be able to be spending time with those loved ones. It's like, I would really hate for them to be, how do I transcribe the notes and how do I create everything so that way, like, to talk to each individual agent, I would rather have a Copilot do it for me. So this is the issue that we're trying to solve. And like, there's a human cost for always on environment. So if we're just being honest, like, if you try to think about, like, I don't know about y'all, but with me, context switching, it's a real thing. Like, there are times where I am back to back to back to back. And I can only imagine what our clinicians have to go through. It's like you're talking to somebody who is, like they might be having, if they're a primary care physician, this person's worrying about their diabetes. This next person's worrying about the child that they're going to have. This next person's doing a broken arm. Just the amount of time that they're switching context and then having to take the notes into that, y'all, it's leading to real burnout, like real burnout. I mean, because there's only so much we can do in a day. And so like and the one thing our clinicians reach out to us is like, we just have got to be able to spend more time with our patients. That's where Copilot fits in. So this is inside of Copilot. Copilot is your HLS, your AI-powered smart assistant. Now, y'all, I'm going to show you all some tips and tricks today. So, I would say that if most people here have used Copilot in some form or fashion, you've got summarization probably down to a science. How are we taking and we're summarizing information? How do we open it up and ask questions of that large language model or that AI model and say, like, okay, take 90% of this information and make it to where I can just go and grab it. But where most people are missing this is the generation. Like, how do I actually grab insights out of this? And y'all, here in a few minutes, what I'm going to do is I'm actually going to show us inside of Excel, like how we can create our own AI agent who can sort through notes and recreate some really cool ideas where we don't have to sift through those pages and pages of notes, because that's what turns this into that assistant. And y'all, we'll just be honest, most people in AI right now are really stuck in that summarization piece. They're just like, that's what it does. And it's like, until you're getting to the generation piece of this one, you're not really going to start experiencing that more productivity. One of the things that's great about Copilot is the fact that we are tied into everything. I don't know about y'all, but I live in Copilot, Outlook, or I'm sorry, in Teams, in Outlook, Word, and Excel. Every single day, I live inside of each and every one of them. So for those of you who don't know, so Teams, for example, right now, we are recording this message. This is going to give me a transcript that I can then send out to everybody. Word, I can actually generate my documents for it. Outlook, how can I do my emails? But there's some things that people don't know that Copilot can also do. Did you know that it can create an infographic? I was reading a fantastic study the other day. Did you know that most people spend 15 seconds on an email? 15 seconds. That you can't do anything in 15 seconds, but they're spending more time with pictures. Great. How do we do that? I'm going to show you all here in a second how we can actually use Copilot, where we can take that down and we can create a picture where somebody can look at it and within 30 seconds be like, hey, this is what my business decision needs to look like. So this all lives inside of these tools. Now, what we're seeing, what we're also seeing here is another problem statement that we're seeing is the clinicians are beginning their day. Like, I don't know about y'all, but my worst time of the week is Monday morning, 8 a.m. It's like I'm going in there and I'm like, oh my gosh, what do I have to do today? What does my week look like? Who do I have to talk to? So it's like, it's that fear of the unknown that I have first thing in the morning. And then before Copilot, you just went to situation and outcome. I would just look at my Outlook and be like, okay, I've got 10 meetings today. I've got to work each one of the meetings. Well, Copilot came in and said, let me help you with some of the stuff in the middle. Let me help you draft that information. Let me help you visualize the data that you've got to work with today. Let me really take that weight off of your shoulders and let you go ahead and do more work. And that is something that actually we're seeing a lot of with people. Like, once they realize how to use these new agentic modes inside of Copilot, that's where they're really starting to see that time savings. Now today we have got so many different examples. One of the things I love is we've been working with Microsoft since the inception. So I have lots of examples. Today we're just going to be using the provider examples, but also think about this. This can be used for payors, farm payors. I don't know why I put the wrong emphasis on the wrong syllable. We have payers, we have pharma, we have medical devices. All of these different people can absolutely come in there and start to use this as well. But folks, our goal at the end of the day is, how do we take information overload and turn it into actionable insights? We are generating petabytes upon petabytes of data every single day. And what do we do with it? Well, candidly, we need our assistant to come in and help us. So, all right, y'all, as much fun as that was, let's get out of the slide deck and let's actually jump into Copilot, shall we? So I'm going to go ahead and joys of having 4 monitors is you have lots of things on lots of different screens. So let's go ahead and bring up Copilot. Now, can everybody see my screen? Did you know inside of Copilot? So whenever you fire up Copilot, I'm actually using the desktop version of this right now. You can actually use the online version of this as well. I want to go into the side that you don't know just yet. So, and that is, like, everybody here stays at this screen right here, like, hey, hey there, can I ask what I can do for you? So this is fantastic because you can go through and you can ask it, like, tell me about my emails that I'm dealing with. So I'm working with one of our salespeople, John Jacobus, is on the phone with me. What's the last 3 emails that John sent to me? Am I behind on anything? What can I do? So if you're using any type of AI, you're probably very familiar with this screen. So I'm going to say, and you know what? For everybody who doesn't know, one of the greatest keys in the Windows universe is Windows H. I'm just going to talk to it and let it do some research for me. All right, so what I want to do is I'm going to create something that I can send out to my patients, and I want to talk about diabetes awareness right now. So, can you go out and research for me the top 3 trends in 2026 around diabetes? So, I want this to be informal. I want this to be something where people might be new to learning about diabetes. Maybe they just got diagnosed with it. I want them to be able to get really digestible information with this. All right, I'm going to go ahead and run that, and I'm going to let it do its research for me for a little bit. So I'm going to let it go through and pull up everything on diabetes right now. So, and what Copilot is doing here is, remember, whenever you're into these what we call these large language models, remember they are stuck in a point in time. So they are all trained up to a certain point in time. Well, what Copilot does is Copilot actually says, you know what, I'm going to go out and get you the most recent information around diabetes. So here we go. So I've got, like the big advances in diabetes technology, especially CGMs and insulin automation. Hey, I like automation. That's why we're talking about AI right now. New and more personalized medications. So like the GLP-1s right now, like this one's actually really, really interesting for most folks. Why does this matter? Stronger focus on whole care and education. So what's changing? And then the final version, what you can send to your patients. Now, inside of Copilot, you can also see, because I always want it to show its work, like where did it get its information from? Well, the American Diabetes Association probably is the best place to start. And you'll notice it was the #1 thing that it pulled out there. And then we went in and we started adding more and more. And it said, okay, here is every place that I got that piece of information from. Now, y'all, I'm going to tell you what's going to happen. Most of your clinicians are going to copy, paste, and send this out in an email. But remember, I was just telling you about 15 seconds. Even me, I was like, okay, there's a lot here. What do I do inside of 15 seconds? So I'm going to pick one of these. I'm actually very interested in this GLP-1 right now. So I'm going to copy this thing, and I'm just going to save it. Now I'm going to go to create. Now, y'all, inside of Copilot, this is fantastic. I have my own person. I have my own graphic designer in here that I can take this and I can create different things. I can create an image. If anybody's on Facebook right now, you're probably seeing the caricatures that are showing up. It can do that. We can create videos. We can design infographics. We can create a story. We can design a poster. So I'm going to tell it to design an infographic based on this information, and I'm going to paste it down below. This needs to be easily digestible to a person who might not understand GLP-1s. Now, inside of this screen, I can go into add content. So if I wanted to go into like my SharePoint drive, I can pull something up. In this case, I'm going to paste it. Colors. I can go in and I can tell it what color scheme I want to use. But one thing that's really interesting is you can actually have a brand kit in here. So each one of your organizations, I assume, has a marketing department who spent a lot of money to make sure that they're using the right amount of colors on here. So Quisitive included, we have our blues and our purples, we know that. So you can have what it recommends, or you can actually have your own enterprise-wide brand kit that you're using. So I'm going to go ahead and just use something out of the box right now. So I like these kind of lighter colors. It's telling me that my palette is selected. It's saying that this is the widescreen. I can tell it, I actually probably want this to be portrait for me. And now I'm going to paste in that information and I'm going to hit create. Now, folks, as opposed to other tools, imagine what this is doing right now. This is actually going out to that large language model. It's saying, I got a lot of really good information here, and I need to get that out because Jimmy just told me a little bit ago, I've got 15 seconds to get somebody's attention. And what it's doing is it's compiling all of this together. It's hiring its own graphic designer. That's part of your subscription. And it's saying like, you know what? I need you to go through and create the graphics for me. And now we can start seeing this thing coming to life with us. So now we can see new and personalized medications, especially the GLP-1s, and it's going through and it's building it. Now where Copilot is different, y'all, and this is where, forgive me, I get really excited about this. If you're using some of the other large language models and it creates content, it's creating a picture. Well, what happens if I want to change something? What happens if I want to add my logo to it? Now I've got to take that data out of something. I've got to go through and I have to manipulate it in some form or fashion. And then I've got to PDF it up. Well, best part about this is not just creating the images. This is creating an editable infographic. So think about that. That is now I have the ability to go through here and actually change the text, because sometimes, you know, we always with AI, we want to trust but verify. So now what we're doing is we really want it to go through and make sure that it's getting the right information out. And here it is. We are done. And you'll notice down here at the bottom, there's now this edit text button. When I click edit text, it goes through, it's extracting the text from the image. Now it takes it a second, but it's now letting me go through and completely edit this document. That is one of the things that puts Copilot above the rest. Is now, if you ever saw me as a graphic designer, I am abysmal at it at best. Well, now I can go in here, I can create that content. I did my research inside of Copilot. I went over here and I told it exactly what I needed to do, and it's setting the image up so that way I can now change it. I can add images on the side. Here we go. GLP-1 for type 2 diabetes. I can click in here and now I can edit it. I can change text styles. I can add my own notes in here. So now this thing is completely editable as its own artifact. Again, you can also, and there's lots of cool stuff you can get inside of here. Removing, blurring, you can move stuff around, but this has created our infographics. And one thing that we're seeing a lot of is we're seeing our users starting to use that. So that's probably is a really, really cool option that a lot of people don't know, that you've got your entire graphic arts team behind the scenes inside of Copilot. Now, if you don't mind audience participation time, anybody throw a thumbs up if they learned something new about that. They're like, you know what, I didn't know that existed. I'd love to see, you know, some of the audience thinking, you know, like that's something that we really weren't thinking about. So thank you, Sarah. Appreciate that. All right, we got a couple others in there. All right, y'all. So now, little did you know, by spending, you know, an hour with me today, you've now become graphic designers. Congratulations. Remember this in your next performance reviews. But let's go to really where I think I want to spend the bulk of the time. So I don't know about you, but my world lives in something like this. Audience participation time. How many people get data extracts and they're like, you know what? Now I've got to make some kind of sense out of this Excel monstrosity. So, and I do use the word monstrosity because I do think it fits. So got a couple people in there saying, Jimmy, you're preaching to the choir. So how do we fix this? All right. So what we can do now is I'm going to take you into a new area of Copilot. Now in this one, what I'm going to do is I'm going to go into the online version of this. Now, y'all, this is really important. Hint, hint, star, star. This is on the final. You want to do this inside of the online version of this. If you're inside of your desktop version of it, you won't have the full functionality that I'm getting ready to send you. And so when I do this presentation in the past, I will tell you that is the #1 area that people have a problem with. So now I'm inside of here, and what I'm going to do is I'm going to upload a file from my desktop. So I've got, let's see, I want to use primary care patients, and I'm going to upload that file. And now here we are, and we are ready to go. Now, what you're looking for, and I always want to start off with this, so I won't make anybody come off of mute, but if you're looking here, I'm looking for this Copilot button. You'll notice it's blacked out. So what we have to do is if you're uploading CSV files, if you're uploading Excel files, you won't have any. This one happened to be a CSV file. So now what I want to do is I want to go ahead and change that to now where it is a. I'm going to convert it to an Excel file. So give me 1 second. File. Give me 1 second. Grab my. Sorry, my mouse has locked up on me. So, all right. Go ahead and upload the Excel file. So there we go. Delete that. Forgive me, I should have had that changed for you at the beginning. So now, what I have here is I have the, so you want to do this in an XLSX file instead of a CSV file. And I want to open up this Copilot button. Now, Copilot in Excel is by far one of the best inventions that we've ever had. And this is somebody who loves Copilot for Teams. And so I would actually put it up against Copilot for Teams. So the first thing that I want to do is what a lot of folks don't know is they can ask for some insights, because if somebody's handing you a lot of information, it's up to you to go through and figure out like what's going on with this document. So I'm going to go ahead and write a prompt. Now, whenever I'm writing prompts, I like to tell it who I'm talking to and what information we come out of here. So let's go back to my Windows 8. Okay, you are a data analyst, and I want you to look at this Excel spreadsheet. I want you to go through and pick out the key themes that are inside of these spreadsheets, especially when it comes to the notes. Are there any key trends that are coming out of here that maybe I want to send something out to my patients to say, I'm noticing this a lot. This would be a good touch point for me. Stop my recording. And now I'm going to run. So what Copilot's doing in here, and this part is important. This has now, since it's just dealing in this Excel spreadsheet, it forgot everything about climbing Mount Kilimanjaro. It forgot everything about creating brownies and making cookies and everything like that. It is literally going through and reasoning over the document itself. And if you're somebody like me who's like really interested in this stuff, you can actually click on this button right here to actually watch it as it's thinking. So it's going through and it's pulling out key themes. Now, why is it important, Jimmy? Why can't I just copy and paste this into Copilot? You absolutely can. But remember, this is using native Excel functionality. Y'all, our biggest companies on the face of the planet are using Copilot to crunch their numbers. I can't tell you how many CFOs who you will never drag Excel out of their cold, dead hands. They constantly using this. This is using the same tools that the smartest people in the world are using. So now we can go through, it's gathering insights, and now it's showing me, got it, Jimmy, I analyzed this one. Here's the free text clinical notes, and it says, most often show up ranked themes: lifestyles, exercise and activity, medication adherence and education, referral and care, diagnosis. Those are the themes. Who's coming up soon in the next 60 days? We have some interesting themes in there. Suggested. Now remember, I asked it, like, I want to talk to my patients. It actually gave me a suggested patient touchpoint campaign, ready to send angles. It went that extra mile with me and said, you know what, Jimmy, you asked me about this. Here's what I recommend. So blood pressure self-monitoring nudge. Now, as somebody who enjoys his coffee and also enjoys his blood pressure meds, that's something that is kind of important to me. So that might be something that I need to look at. Inside of Copilot, we can also see where it pulled the data from. So again, with anything AI, trust, but verify. So we can go through, we can look at that. And especially as you start getting into more and more complex spreadsheets, that's something you want to start looking at. So now, so here's each and every one of these. So here's some segmentation cues. I can generate uploading lists, etc. Now, y'all, I might have showed you something new, but now I want to show you something cool. So what happens when you've got that massive spreadsheet and you're like, I don't want to ask questions of this spreadsheet. I want it to do work for me. So that is where this little button right here clicks in, and that's Tools and Agent Mode. So Agent, now what Agent Mode does, folks, is this unleashes the power of an AI agent who knows Excel better than the person who created it and said, you know what? I want you to go do work for me. So what I want to do is I want to look at this and I want to see so I've got my insurance provider here. I've got my notes. I've got my diagnoses, and I'm going to go into agent mode and I'm going to let this thing work. Now, y'all, this takes a few minutes. So if I'm actually letting it create sheets and things like that, it's going to take a few minutes. But what I want you to think about is as it's working, like how much time would this have cost you if you had to do this yourself? So I'm going to tell it the following. I want you to create a new sheet for me. And inside of that sheet, I would like to see a breakdown of people by providers. And then if you can, go ahead and give me a copy of the diagnoses also. Because what I really want to do is I want to see, is there anything that is specific to a provider, like an insurance provider, or is it something else? But that diagnosis is also important to me. So okay. I'm going to now, good thing about LLMs, I kind of rambled a little bit. It's now going to run and it's going to start working. So what I have done is I have given full access to this to say, you know what, Copilot, go do my work for me. So imagine your clinicians going through and asking questions of Excel spreadsheets, asking questions of Word documents, and then letting it create insights. So as much as I can tap dance, I'm going to show you a fully baked out example while I'm letting Copilot work. So can everybody see my Excel spreadsheet here? Okay. What this is this shows me a breakdown every morning by clinician, specialty, appointment ID, what the appointment type was, the status, the location, and the notes. Well, what question do I want to ask of this data? Good question, Jimmy. I don't know, because somebody, and this is where people go into AI and they're like, well, what themes are out there? So when I went to agent mode, what I simply asked it to do was I said, hey, can you give me a visualization of this data where I can see a calendar view? And the agent mode itself created this for me. I never touched it, y'all. And that's what it's doing over on the other side. It went through and based on that Excel spreadsheet, it gave me an appointment calendar. So you can see here on my Sundays and my Saturdays, I have no appointments. On my Mondays, Tuesdays, Wednesdays, Thursdays, Fridays, you can see exactly how many appointments I have. And then you have the ability to see a breakdown of what all of that looked like. What that did for me was it visualized the data, because that's where we don't know what we don't know. That has the ability now to where I could say, hey, if I'm looking at this on the 11th, I'm seeing 70 appointments. On the 31st, I'm seeing 74, but I'm only seeing like 65 on the 17th. That visualization is incredibly key for me, because now I didn't have to go through and fight out through the Excel spreadsheet, create my pivot tables or anything like that. I just told the agent, hey, create me a calendar view and let me look at it. Then after I've got this visualized, I started noticing, I was like, Dr. Nair here looks pretty busy. Tell me about Dr. Nair's notes. And what this did was it then split off for this clinician the ability to see what their date was, how long it took, what type of visit was it, a telehealth vaccination procedure, and what the notes were. And now we can really look at this and say, okay, Dr. Nair, we see 17 minutes for a telehealth visit. We see 11 minutes. Hey, wait a second. We got 64 minutes here. Oh, that makes sense. This was a cardiac procedure. We can see here, we're noticing that the procedures seem to be taking longer amounts of time. So is there a way that we can juggle the telehealths on one day and then bring in the procedures the other day? Can we do that? The answer is we absolutely can. But this now took that data, broke it down, let me see exactly at my fingertips. So now I could even then go into Copilot in this screen and ask it, and let's just go ahead and do it. I'm going to go ahead and into Copilot. I'm inside of this screen and I can ask it, like what's their average duration in minutes, etc. So like you can see here, I still have this analyze this workbook and give me insights. I can say, what is the average duration of Dr. Nair's procedures? Remember, AI likes to be very, very focused on the amount of data it's given. So a lot of people say, well, go out and get everything. But now I can really say, I really want to focus on this Excel spreadsheet. So now I cut that down. Here's Dr. Nair's procedures. And now it even gives you some examples, show the average by week. Okay, show me the average by week. It's going to review the data. Y'all, this thing writes your VLOOKUPs, your HLOOKUPs. If you know what those are, great. If you don't, that's how it arranges data. I am absolutely the worst at VLOOKUPs and HLOOKUPs. It does a phenomenal job of going through and absolutely looking at each and every individual piece as well as visualizing them out. So we can visualize it, and it's saying you can visualize this in a chart, break it down by location. So let's go back to our Copilot and see if we're done. When last we left, we had this sheet right here. This looks like a technologist, and I am a technologist, created it, because we did. But now you can see here, I've created a new sheet called Provider Breakdown. This gives you a comprehensive breakdown of views by patients organized by insurance provider along with their diagnosis. And then it explains to you why it created that. I don't know about y'all, but sometimes when you get data from somebody, you're like, and where did this come from? Why did we do it? How did you create the calculations? This is the world's best programmer because it's going to explain it to you. So it says, okay, here's your summary table. I gave you a detailed patient list by provider. Patients are grouped by their insurance provider. Hey, I created a cross tab here for you. And we can see Medicare, Blue Cross Blue Shield, and Cigna. And it tells you how it did it. I used a count if, I used a text join. So this data will automatically update if you add more patients to the source sheet. Think about that, y'all. In this same sheet, you can now start adding in more data, and it's going to go through an update. Let's get to the ta-da moment. Ta-da! Here is your Excel dashboard. So now I can look at this very, very easily and say Aetna, Blue Cross Blue Shield, Cigna, Medicaid, United, these are our primary diagnoses. So I'm going to copy this out for a second. I'm going to do some cool stuff. So I'm going to now go into, let's go to my checklist. I'm going to start with this prompt right here. Visualize an infographic, because I love the colors there, the 6 topics. I'm going to say visualize an infographic. We're going to call this breakdown by provider. it actually gives me what this is going to look like. Here is what you need to create. Here's the data that you need in order to make this visualization. Paste that in, create, and I'll come back to that here in a second. But let's go ahead and go through the rest of this. I'm going to say, okay. We can see our breakdown list. So, if you're dealing with a lot of provider information, so like your back office folks, it's like, oh, like I know that for me, I'm going to spend X amount of time on Aetna versus X amount of time on Medicare. Here's all the information that I have for everything. Hey, you know what? We know that if we're dealing with Medicare, for example, we need to provide additional information in case the customer has coronary artery disease. We understand that we're going to spend a little bit more time on that. We can see the diagnosis breakdown by provider. So now we see like first it went ahead and sometimes it'll give you some extra stuff like here's the tables that it has. So we can see there's acute bronchitis, benign prostatic. You can just hear my medical jargon just go through the floor. So benign prostatic hyperplasia. So people with gout, but it actually went through and created all of this information for you. Y'all, as long as you can tell it what you want it to do, it can create it. So you can create marketing slicks. You can create more and more information based on that. And then I can take it and dump it in here and said, hey, based off of everything that we had by our provider, here was the most trends that we had out of this one. And I actually pasted the old one. I apologize. So this had everything for the GLP-1s. So, but this part right here, I think is probably one of the most important pieces that we have inside of Excel. So now, again, you can actually tell it that you want to create more objects out of here. So that's where this agent mode is so important. You can say, you know what, I just want a sheet of all of the patients above 55. I want to send them some information. Let's actually take that down to 45. Information about their yearly or their colonoscopies. And again, that agent mode is actually going out there. It's doing the filtering for you. It's asking the questions and it's adding things on. Now, you always want to make sure that you're saving your data. And the good thing is you have version control in case you ever have to roll back a step or anything like that. But that is something by far that I think is probably one of the most important things that a lot of people know. So how would I use this every morning? The good thing is you have a lot of, you have a lot of your healthcare systems out there. You can go through and you can say, I want a daily dump into my SharePoint. And then I want to put this Copilot agent on top of that. But again, we're not programmers. I remember when we used to create macros, they're no longer VB based, Visual Basic based macros. This is now using natural language. And here you can see we've got the ability, like here is my list of my folks that are over 45. And how do I send that information out to them? And so now let's go back and tie it into our Copilot again. So I want to do a search. I would like for you to do some research for me and give me a list of 6 benefits of having your colonoscopy after you turn 40. This is something that I want to send out to my end users, and I want this to be very, very user friendly. So help me with that. So I'm doing my research inside of Excel. Going back to Copilot to see what it looks like. It's going to say, okay, what are you referring to? Do you want me to research or do you, it's asking me questions. What do you want me to research? Yearly colonoscopy benefits. Okay, we can see here you need to start screening for everybody. It is beneficial. What's the benefits? All of that piece of information here. I'm going to click copy. I'm going to go to create. Let's go ahead and we can create a let's keep it with let's go ahead and do a poster, shall we? So we're going to paste that in here. I'll probably want to get rid of that text at the bottom. And my brand kit. So again, you all can create your own brand kits. It's funny, I always sit here and tap my finger. I'm like, man, this is taking forever. Which if I realized that, this would have taken me hours to do, but I'm letting Copilot do it for me. So while we're letting it wrap up it's the good stuff that it's doing. So is everybody here? Is there any questions inside of the chat where you're like, Kevin, I think you've been answering some questions for me. I appreciate that. Is there any questions that you're having that we can answer inside of the chat?
Yeah, Jimmy, I answered a couple questions. I did want to, take a moment here for a commercial for Quisitive. They are a very trusted partner with us here, specifically in the healthcare provider space. Both myself and my team have seen them do great work across multiple customers. And Microsoft does have funding for engagement where they can come in and work with you guys, fully funded by Microsoft.
Perfect. Thank you for that. Yep. And I love doing the commercials and everything. So here we go. We now have our poster we can send out where we can actually look at this and we can see exactly what we did our research. We found out that, hey, we need to send this out. Here you go. You'll have your brand kit. Away you go. So I'm going to wrap up with a couple of slides, but if everybody doesn't mind, what is always immensely helpful to me is if I could see thumbs up and thumbs down. Did everybody learn something today that they didn't know before? That is the best thing that I can ask for. So perfect. All right. Let me go ahead and open up my last couple of slides, and then we're going to end with one last piece. So give me 1 second. I apologize. I actually closed out my other one. Gotta love the demo gods. So here we go. Paste this back in. Now, y'all, I know that 98% of statistics are made up on the fly, but these are absolutely not. So this is something that we have seen. The Stanford Medical Journal deployment, they said that 78% of their physicians at Stanford Medical have expedited their note-taking after this. And if you think about that, that's important. Having teams up there that can transcribe that information and then being able to get insights on it. So what I just showed you in Excel, it can be used in Word, can be used in Teams. All of that it's readily available for you. So the thing that I think, and Kevin, Sarah, and I think we're so proud of this, 96% of the physicians, once they learned how to do this, they all said that the tool was very easy. Y'all, I didn't have anything pre-programmed. You saw a couple of hiccups. There's some natural, hiccups along the way, but you saw that it was just really sit down, chat, use the same front end that you've used over and over again. So this is something, you can go back to the Stanford research. I think it's such a great story about how easy it was for them to use. So let me see. I lost my mouse. Where did I lose my mouse to? Okay. Now, the ROI behind this is we're seeing from weeks to minutes, complex research queries. So, people are analyzing tons of information and they're seeing it there, whether it's being petabytes of data, which would be on your Azure scale, or, if you're looking at, like your patient records and things like that, which would be more on side of the Copilot side of it. what they're really seeing is things that used to take people like 3, 4, 5 days are now just taking a matter of minutes. As long as you know how to use this, as long as your data is stored out correctly, and that's where one of the things we can help with is making sure that you're ready for it. Really go through that priority of like, how can we save time? And the thing I would be absolutely remiss if I did not talk about is the safety and security behind it. Y'all, you are all bound by HIPAA. The thing about Copilot is we are HIPAA compliant, so there are safeguards inside of there. So there are special layers that are built into there for safeguards and compliance, as well as your commercial data protection. As long as you're paying for that Copilot license, you see the work, you're going to see that protected by commercial data protection. You know that that data is absolutely safe and secure and ready for your folks to use. So that's something, as I would be worried about it as a data professional, for a fact that Microsoft is. To our Microsoft partners, Sarah and Kevin, the Quisitive team, we definitely appreciate you all, and we'll see you for the next webinar.
Thanks, y'all. Adios.
Thank you.